Good afternoon, everyone. I'd like to thank Patrick and the organizer for inviting me to this important meeting. I'm honored to be a representative of the Latin American hepatology. My task in the next minute is to show the situation of HCV in Latin America. Let's share my screen. So is elimination of HCV by 2030 realistic in Latin? First of all, let me show the Ali position took a few years ago. HCV is one of the main public health problems in Latin America. There is no robust data about HCV epidemiology in our continent. Data from each country may not be useful in other countries. We are really heterogeneous. We need more epidemiological information from Latin countries to propose broad and solid public health policies. We don't have this up to now. We don't have this so far. This is the scenario of HCV in Latin America. Many differences in terms of prevalence in each country, but we estimated we have 7 million HCV carriers, but 70% not diagnosed yet. It's a really bad scenario. Brazil, Mexico, and Colombia account for more than 40% of HCV cases in our continent. HCV prevalence was overestimated in the last decade in Brazil, based on some epidemiological and regional studies. We thought we had 2 million people to be diagnosed and treated, but now this number were revisited, and we estimated we have still 700,000 patients to be diagnosed and treated in Brazil. Let's see what's happening now. We are diagnosing by screening 18,000 patients per year, probably less than this, using 1 or 2 million tests per year. It's optimistic scenario. We would have to screen to diagnose 50,000 patients per year and to treat all these 50,000 patients per year to reach the elimination of HCV by 2030. Let's see, in Latin America, we need 100,000 patients per year. It's not realistic. It's impossible in our current scenario. So how about our public policies? It's really difficult because a few countries have structured hepatitis facing program. Public system has no condition to do an universal screening program in most countries. We need to define if we insist in universal screening despite all operational problems and costs, or we focus on group of risks. Brazil, this is the Brazilian choice, and it's not doing well, in my opinion. HCV elimination in Latam has many barriers, medication costs, non-pangenotypic treatment, access to genotype and HCV RNA in many countries is still hard, difficult. Awareness of the health professionals, especially non-hepatologists, and the structure of public health system is very heterogeneous from country by country to other countries. On the other hand, we had many opportunities to improve. For example, introducing the pangenotypic drugs, diagnosis and treatment conducted by non-hepatologists, educational and follow-up programs like the Laurea and ECO program conducted in Argentina that are helping many physicians from isolated areas to conduct the treatment of hepatitis C in Latin America. This is how to place hepatitis C in this scenario of COVID-19 in our continent. COVID is a disaster in Latin America. Let's see the numbers of deaths in Brazil and Mexico since March 20. It's really incredible. So it's how to place hepatitis C as a priority in this scenario. And also, it's not enough to face SARS-CoV-2 in our continent. We also need to face the virus of intolerance, totalitarianism, and denialism. It's really hard for us in this period. So there is no evidence that LATAM could eliminate HCV by 2030. Thank you very much. Merci beaucoup.